And Las Vegas is unique. Not only do people have lots of allergies, but they have a lot of non-allergic rhinitis as well because of the dry, dusty air. Allergies are the body's response. It's an immune response to an allergen, which is a foreign body. Typically we associate with a pollen. So grass, weeds, trees, but it can be pets, animal dander, dust mites, molds. Those are the common ones you think about. Sometimes it can be seasonal. Those are the ones you think that are the airborne ones. But people can have perennial allergies. So those are things around the house, pets, dust mites, molds. Typically, the symptoms you think about are sneezing, itchy, watery eyes, itchy, watery nose, sometimes some irritation of the throat, coughing. Anybody who has allergies pretty much knows those symptoms. The difference between that and a cold you get more just runny nose, not so much sneezing, tends to be more self-limited, 7 to 10 days, maybe some yellow or green drainage, often a sore throat. So the symptoms are a little bit different than the typical sneezing and itchy, watery nose that you have with allergies. When you look at treating allergies, there are different ways to treat it. One, if you know what you're allergic to, you can kind of avoid that, which is kind of hard if it's just the pollen in the air, which you can keep your windows closed, keep your house well dusted, change your filters. If you have dust mites, you can put covers on the bed. You can do some things with your pets to minimize the animal dander. But most of them involve taking medications. There's a variety of medicines to take. First of all, there are antihistamines you can take over the counter. Claritin, Allegra, Zyrtec, they're the non-sedating antihistamines you can take over the counter. Those all used to be prescription, and now they're over the counter. Benadryl, people find that works pretty well for them as over the counter, but tends to make you kind of tired. And so if you're going to take that, take it at night. There are nasal steroid sprays. So nasal steroid sprays, if you look at all the medicines, those are the ones that work the best. So for single medicines. 2 recently came over the counter now, Flonase and Nasacort. In fact, we have a lot of times problems getting our insurance companies pay for this prescription nasal steroids because those 2 are over the counter. You can combine those. You can combine an antihistamine and a nasal spray, and they'll work synergistically. They'll work better together than they will apart. What I take, because I've seen no allergies, I take a medication called Dymista. Not as a plug, but just say for Dymista. It's a nasal steroid and nasal antihistamine together. Use it twice a day. So if you want to ask your doctor for Dymista, that's what I use. If it gets severe enough, and patients have trouble, they want to just know what they're allergic to, you can get tested for allergies. It used to be you have to send anybody for the allergist just to get all the skin tests. Now there's a blood test that's available. It's at all the labs in Las Vegas, Quest, LabCorp, CPL, and it tests actually for the specific substance called IgE that your body makes to each specific allergen. So if you're allergic to any foods and all the common dust, mold, grasses, weeds, trees, you can test for those specific things. You can see 1, not only if you're allergic to it, and 2, how severe your allergies are. If people have severe allergies, you can then may need a referral to an allergist. Well, they can do a lot more comprehensive testing and may need shots or immunotherapy. So if I have a patient that's really severe allergies, no problem sending the allergist to get those tested. Actually, my son's on allergy shots as it is. A lot of people have trouble not only with allergies, but just with the dry, dusty air. So I hear almost every day here in the office how they go to San Diego, they go to California, their nose and sinuses, everything feels great. They come back to Vegas, they have sinus pressure, their nose runs, and it's just the dry, dusty air. It's just the low humidity that we have here. And so everybody I recommend, just kind of general nasal health thing, anything you do to keep your nose moist. So saline spray, saltwater spray, humidifier, change your filters, anything to kind of keep the dust down and keep the humidity up in your nose. The function of the nose is to warm, filter and humidify the air. And with all the dry, dusty air we have, it tends just to sometimes just overwhelm the nose.